Hello again, and thank you for joining us today. We are waiting for Sam, our lab manager, who has some technical problems, or maybe we can start without her, and hoping that she will be able to join us. Let me introduce tonight's esteemed panel. Professor Sheena Lewis, CEO Examen, Honorary Professor, Queen's University Belfast. Samantha Knight, who is on her way, hopefully she will join us soon. And Mr. Reid, personal trainer, ex-MMA, HSFC patient, and guest speaker, and father to Anastasia, made with science and love from HSFC. Tonight's agenda, the presentations will be 30-45 minutes, and Professor Lewis will cover what men really need to know. Sam will talk about the lab perspective, and Alex will talk about his journey to have baby Reid. The event will be recorded and uploaded on our website in due course. At the end of the webinar, there will be a session of questions and answer Q&A. Please raise your hand or submit questions via the chat. You don't need to say your name. You can stay anonymous. So your camera will be off. All panelists have no competing interest to declare. And without further ado, I would like to hand over to Professor Lewis, who would like to tell all the men present and all the ladies and all the women what men really need to know.
Just to jump in quickly, our lovely manager is asking to be let in. She's in the group. I think you need to let her in, Delia.
I think you need to register.
No, this is Samantha. She's already there.
I think you need to let her in.
Can you admit her? And also, can you move on?
Okay, so she's here, but the camera is off. So Sam, can you say something?
I think you need to let her in as a panelist. Delia, can you move my slides on for me, please?
Yes.
Okay, so hello everybody, and thank you very much for being here. I know it's the end of the day. You've probably been at work, you're tired, and it's really good that you've come along to listen to what we have to say, and I hope we'll make it worth your while.
Sorry.
No, hang on, go back, please. Oh, great, okay, thank you. So I'm going to talk a little bit about male fertility tonight, and I think one of the greatest desires that human beings have is to have children. Now, some people don't want children, that's absolutely fine, but lots of people do want children. And yet it's very, very common that people need to have a little bit of help to create their families. There's no stigma about it, there's no shame about it, there's no blame about it. It's a medical condition just the way other things like diabetes are. And so it's something that we should be able to talk about. And sometimes men feel that it's like a stigma on their manhood, that if they have male fertility problems, that means that they're not virile. And I can tell you from 25 years working in this area that I have seen big, strong, healthy men who have low sperm counts. There's no relationship at all. On the other hand, I've seen very tiny, small men who've had huge sperm counts. So there's no relationship at all between a man's body and how he looks and how he performs, even in bed. There's no relationship at all with that and whether or not he's got a high sperm count. So men shouldn't feel any embarrassment about going to see a doctor and saying that there are some problems. Next slide, please. Excuse me. Thank you. So it might surprise some of you who are listening to know that male fertility is one of the most common reasons why people go along to have investigations. And for a long, long time, we thought everything was to do with the woman. As long as the man could produce one sperm, you know, that was enough, and that would be all that was needed to get his partner pregnant. But actually, 37% of the causes of infertility are male ones. And if you think of unexplained infertility, which means we don't really know what the problem is, that's probably about half and half. So that's a lot more of the problems that are associated with the man. Now, as I said before, this is nothing to do with blame. We're just trying to work out what the causes of infertility are. It may surprise you too to know that 1 in 6 couples experience infertility problems, and that's a huge number. Everybody knows somebody. When you're sitting on a bus, there'll be somebody on the bus. When you're sitting in the cinema, there'll be somebody in the cinema. In the supermarket checkout, there are people everywhere. They're having these problems. So it's very, very common, and it's something that we should talk about a whole lot more than we do at the moment. As you probably also know, the success rates are not very good. They're only about 30%. So it takes people a while and sometimes several cycles of fertility treatment before they can have the baby that they desire so much. But wouldn't you think if at least half the problems are male, that we would spend half our time trying to fix those male problems? But actually, that's not the case at all. It's probably about 10% of time is spent on the male and 90% of time is spent on the female. And I believe that if we spent more time looking at the causes of male infertility and trying to fix those, then our success rates would improve enormously. Next slide, please, Delia. So a few years ago, a big scientific publication came out, and it said that sperm counts in the Western world were plummeting. And I'm sure this filled men's hearts with absolute fear, because you know how papers like to sensationalize things and make them even worse than they are. And there were these ridiculous comments like sperm count drops would make humans extinct. And although it is a problem, and funnily enough, I was at another conference this afternoon where we were talking about this, was this decline in sperm counts fact or fiction? And really nobody is quite sure, but it does look as if there's a decrease in sperm counts in this generation of men compared with their fathers and grandfathers. But that doesn't mean that the decrease in sperm count means that they're more infertile people, because there's still, a man can have, you know, millions of sperm per ejaculate. So even though sperm counts are dropping across the Western world, it doesn't necessarily mean that lots and lots of those men are infertile. But what I do think is that these sorts of headlines in papers make men feel very embarrassed. If you think about this one at the bottom in the Observer, the male infertility crisis, my failure at fatherhood ate away at my very being. Now I know Alex is going to talk to us later about his experience in having some treatment, and he can tell us, you know, from a personal point of view, what it felt like for him. But I know in my years of experience that I've talked to many, many men and their partners, and I know that this is quite a common feeling, that men feel a bit helpless. And also when they go to fertility clinics, the fertility clinics are quite often much more interested in women, and they spend a lot more time talking to the female partners, and they can sort of leave the men out and make them feel a bit as if they're just a sperm donor instead of being a man and an equal partner in the treatment. Next slide, please. Now, the other thing that's really, really surprising is there aren't actually any therapies for men on their own. You find that really hard to believe, don't you? The only thing that we have for men is ICSI. And of course, in order to have ICSI, you have to use the woman, you have to use the female partner, even if she doesn't have any problems. So she has to go through a very invasive procedure. Now, I'm not saying for 1 minute she doesn't want to do it. Of course she does. She's not being coerced into it. She's very keen that the two of them together can have their own baby. But for 40 years, we've had IVF. For 20 years, we've had ICSI. And if we could find a way of improving men's sperm without using ICSI, then it would be a lot more helpful for both the man and the woman. Next slide, please. So I think we've come through a whole transition for men, which is not really a good one. In the past, we used to look up to men. We used to think of them as being very strong. Now, sometimes that was pretty bad because they could be very, very bad leaders and very bad rulers. But generally, we looked up to men in society. And now we find so many men, particularly in the infertility area, who feel completely emasculated, left out, alone, and they don't know who to talk to, and they don't know where to turn. And very often when they and their partner are having treatment together, they think that they have to be strong for their partner and not show their dismay or their hopelessness. And that makes them feel even more excluded from the whole situation. So it's very difficult. And I think we have to think a lot more about how men feel and do a lot more to try and support men. But I think that is happening. And again, maybe Alex can tell us about that too. There are a lot more male support groups now than there used to be. There are groups that men can talk to other men and they can chat about these things, and it gives them a sense of togetherness and to feel that they're not the only man who feels like that. Next slide, Delia, please. So I want to tell you that there are a number of different tests that you can have. Excuse me, the first one that we start off with is a semen analysis. And that's very important. That's the gold standard. And that's the starting point. And that gives you 3 measurements. One is the sperm count, so it tells you how many sperm you've got. The second one is the motility, and that tells you if they're swimming or not. And of course, it's very important that they're able to swim to the egg and penetrate the egg in order to fertilize it. And the third one is the morphology. Have they got a good structure? Are they handsome looking sperm with straight tails and nice shaped heads and nothing quirky or unusual about them? But that's not all that we need. We know that from the semen analysis, as I was saying earlier, about 25% of people are given a diagnosis of unexplained infertility. Now, this diagnosis doesn't mean that there's nothing wrong. It just means that neither the doctors nor the scientists know what is wrong. So I would suggest that there are other tests that you need to have as well as a semen analysis. And the test that we're involved in our company is a DNA test, because it's the DNA of sperm which really is going to be the most important part. That's the bit that makes the child look and act like their dad. So obviously that's very important that that quality is good. Next slide, please. So this is just what I was saying, that a semen analysis can't detect the problems in some men, and you need something else as well. And the big advantage that men have over women is that men produce new sperm every 3 months. Now, a woman, as you know, has eggs when she's born, and those eggs just get older as she gets older. So when she's 40, her eggs are 40 years old as well. Whereas men produce new sperm every 3 months. So even if a man were to have a semen analysis or a sperm DNA test and find that he had poor quality semen, with lifestyle changes like stopping smoking or losing weight or getting fitter or improving his diet or taking some exercise, all of those things can have a good effect on sperm quality within a short period of time. So it's not too hard for a man to change what he's doing if he knows that it's going to make a big difference. Next slide, please, Delia. But what I'm going to suggest to you is that really, for a man to be diagnosed properly, he needs more than just a semen analysis, because there are lots of other things that can affect a man's sperm. Now you can see this picture at the top of a little boy who's got mumps, and you can see that his neck is very swollen. But when you get mumps, sometimes you can also get swelling around the scrotum, and that can actually affect the quality of sperm in the testes, even when the little boy grows up to be a man. So it's very important for a doctor to take a clinical history and ask a man, have you ever had mumps? What are the illnesses that you've had as you were a child? Were you ever kicked when you were playing football and have an injury around the scrotum? Because things like that can have an effect on sperm quality. Have you ever had pelvic pain? One of the most common pains for a man to go to see the doctor is low back pain. And that's quite often from a urinary tract infection or perhaps a sexually transmitted infection. And those things, of course, can be cured with antibiotics. And when they are, then sperm quality can improve as well. Another thing is called prostatitis, which is an inflammation of the prostate gland. And the prostate gland produces some of the fluid that forms semen. And again, that's something that can be resolved very easily. Another thing which is really surprising, and this is, if you look at this bottom picture, and this is a picture of the testis and the scrotum with varicocele. Now, these are like varicose veins on the top of the scrotum. And because these varicose veins pull a whole lot of hot blood, they can actually decrease the quality of sperm. But these can be repaired even as an outpatient procedure. And if you remove those varicocele or you tie them off so that the testes go back to their lower temperature of 35 degrees, then again, within 6 months, that can improve the quality of sperm. So there are lots of things that men can do which actually can improve their sperm. There are also things that men can stop doing. And one of them here, you can see there's a picture of a guy taking protein shakes. And there are some studies that show that people who work out at the gym and take protein shakes, which contain nandrolone, which is a steroid, can actually impair their sperm quality. So those are the sorts of things that a doctor can ask men about and see if they can do things to make his lifestyle better and then his sperm quality better. Next slide, please. Now, I don't know if you know a guy called Rod Gilbert. He's a comedian and he's very, very funny. And I met him at a show called the Fertility Show just before COVID. And he was chatting about his own fertility problems. And he runs a group, you know, for the men can go to online and chat about fertility. But in one of his big shows, he had a whole crowd of couples in the theatre. And he said, how many men know what a gynecologist is? And of course, they all stuck their hands up because everybody knows and everybody assumes that fertility is to do with the woman. But then he said, how many men know what an andrologist is? And not a single person put their hand up. And yet that's an andrologist or a urologist. Those are the people that men should go to see because those are the people who know all about male reproductive health. Gynecologists know about female reproductive health. Next slide, Delia, please. So this is just the point I was making, that 30% of women who have ICSI have no fertility issues of their own. And so if we could find solutions for male infertility without using ICSI, then that would be much better. Next slide. So I advocate couple care and couple choices, because I think in the picture at the top, you can see that the man and the woman are just sitting very quietly, looking a wee bit confused and as if they're not quite sure what's going on, and the doctor's doing all the talking. But actually, very many people pay for their own fertility care. And so I feel it's a bit like if you were going to buy a new home, you'd be asking all sorts of questions because you're actually the person who's in charge. And here it's the same. When you go to see a doctor, you should have a list of questions, particularly the men, and they should talk to the doctor about all their concerns and worries, because this is the best way to treat the couple. Next slide, please. Now, one of the other things that we found, and this is one of the people who's in my research team, and we published a paper saying that sperm DNA fragmentation or damage was a marker of miscarriage. And this is quite surprising because from the days of Adam and Eve, we've always thought that miscarriage was just a female problem. But what we found was that men whose partners had either sporadic, that's like one miscarriage or several miscarriages after either natural conception or after fertility treatment, these men had one thing in common. And that one thing was that they had twice the amount of sperm DNA damage that fertile men who produced a baby had. So there's a big relationship between men and miscarriage, and the link seems to be sperm DNA damage. Next slide, please. So now I just want to spend a few minutes telling you about some of the things that are enemies of your sperm. And you can see them here. One of them is your mobile phone. If you keep it in your pocket, very close to your genitals, then that's not a good idea, and it can impair your sperm. Obviously, the man at the top's a bit overweight, so losing some weight would help. The next one along is your diet. Eating too many fatty foods is not good for you. The next one, I'm afraid, is male age. Now, there's nothing you can do if you are older when you start your fertility treatment, but I'm very keen on the idea that we should tell boys, even when they're in secondary school, that they have a biological clock just the same way as women have. And so they need to think about building a time into their careers when they can have their family just the same way as women can. Now, the other one down there at the moment is sexually transmitted diseases, and we know that this has a relationship with infertility as well. The really fit guy there, that goes back to taking too many protein shakes. The one at the bottom, somebody who's taking cannabis, we know that cannabis slows down your sperm, and your sperm just, you know, the way when people take cannabis, they get very chilled, very laid back. Well, so do your sperm. They get very chilled and laid back, and they don't swim very well. And then, of course, the last one here is people who are drinking too much, and too much alcohol can affect your sperm quality as well. So those are really all the things I want to say. I have some more slides, Delia, but I think I've taken up enough time now. So I'm going to hand over to the next speaker. And if anyone wants to ask me questions at the end, I'll be delighted to answer them. Thank you for listening.
Okay, thank you, Professor Lewis. It's Sam's turn. Sam is on the phone, so she couldn't log in, but we'll try this way. Sam?
Hey, babe. I'm just going to talk briefly about the laboratory
I can't hear. I'm not sure.
Can you hear me? The name is really important in assisted reproductive technologies. Okay, and it's trying
I can't hear either.
There are different treatments that all of them request that. Next slide, please. So at the moment at Harley Street Fertility Clinic, we're sticking with the 2010 criteria that we are shown on the slide. So we expect a
Sorry, I can't hear. I can't hear.
Not at all?
No.
Okay. So let's try again. Sam?
Okay.
So
can you hear me now, Sheena?
Yes, I can hear you now.
Excellent. So what is normal sperm? So at Harley Street Fertility Clinic, we're sticking with the WHO 2010 criteria at the moment. So a volume of semen greater than 1.5 mils, a concentration of more than 15 million per mil, a total motility of greater than 40%, and a progressive motility greater than 32%. And normal form, so sperm that looked like textbook sperm of 4% or above. Next slide, please, Delia. So the treatments and trying naturally are dependent on the sperm quality and factors. So if you're trying naturally, it would be an ideal situation if you had a normal semen parameters. You can have IUI, which is least invasive. So that's where we prepare a sperm sample, and then the female partner has intrauterine insemination. And that's suitable for people with mild male factor fertility issues. Or there's IVF, so where the female partner undergoes some stimulation and has eggs collected. We mix the eggs and sperm together in the laboratory. Or there's ICSI, which is intracytoplasmic sperm injection, which is where we pick up an individual sperm and we inject it into eggs that have been collected. And there's IMSI. So IMSI is similar to ICSI, where we pick up the sperm and we inject it into eggs, but we use a higher magnification, which means that we can see inside the head of the sperm in greater detail. So we can see vacuoles in the head, and it allows us to pick the best looking sperm to put into an egg. Next slide, please, Delia. Okay. We select the best sperm with the best morphology, so those that look the best, and under high magnification speed, those with the least number of vacuoles in the head. Next slide, please. So the benefits and disadvantages of the different techniques, as we said earlier, so obviously people that have IUI is the least invasive and the most natural of assisted reproductive techniques. Then you have IVF. So it's more natural in the way that the sperm and the egg are put together. It obviously still requires sperm to fertilize the eggs. It's better when the egg quality is poor. So for ladies who may be slightly older, sometimes it's a best technique not going to cause any damage. The sperm quality and it's not suitable for most eggs. So only 3 eggs, the donor which is like the egg, which are hardened, and therefore it's very difficult to actually fertilization with IVF. So the benefits are it's very good when the sperm is suboptimal. The disadvantage is that it's more intensive. It's definitely required when the eggs have been frozen. And we can only inject mature eggs in the UK. And then IMSI is, the benefit is that, as we've said previously, you can select the best looking normal egg. Okay, and the disadvantage is that it takes time under some intense light, which could damage the sperm. Because we're looking at a high magnification, it takes quite a while to select the sperm. Next slide, please, Delia. So I'd like to thank everybody who's part of the Embyology team. In fact, every team that participates in this clinic.
Thank you, Sam.
It's over to the next speaker, which is probably Alex.
Yes, thank you, Sam. Please stay on the line for questions at the end.
I will.
Thank you, thank you. Alex, your turn.
Hi guys, can you hear me okay? Hello, can you hear me?
I can. I hope everyone can.
Yeah.
Oh, brilliant. I've just there's been a few issues with being able to hear it. So right, okay, so here we are. I'm 46 years young. I still feel like an active young superhero, but I realised there's certain things about me that aren't as young as I used to be. I have a beautiful little girl who's 10 years old next week. And I have in my past, it's really listened to hear the professors talking about the bad things we've done. As young men, we think we're going to live forever. The eternal Peter Pan. I've played with recreational and performance enhancing drugs, which I wouldn't say excessively, but I have used them. And I already had a child 10 years ago. So I think I now have a beautiful little girl who's 10 months old. But she took 7 years to come because I thought, hang on, what's the problem? I'm fine. I'm young. I'm fit. I've already had another child. I've got no problem with my sperm. I'm a real man. And of course, I had problems. And learning, I've become, I wouldn't say an expert, but you do your due diligence. No, the days of the sex, drugs and rock and roll, the silliness have long gone. And they went a long time ago when I was struggling to conceive to get my new beautiful little girl. And I thought, okay, I always was conscious that I know Mum had problems with some fertility issues, but I started to learn, and it was great with the Harley Street Fertility. It's not just Mum, it's a team effort. What can I do to possibly have the most perfect sperm? Because we had to do ICSI ourselves. I had lazy semen, and I put that down to some of the drug use in my past, but more so the stress. For those who don't know, I'm an ex-professional fighter, and as a kid, I got fighting in the playground. I got hit in the balls a few times, and in sports, and that I remember having to go to hospital because I'd been kneed in the groin area, and my bits went black. I never really realised what that could have done until the professor was just talking about that. There's all these different issues, but the main thing I had was stress beyond stress, and that is the most debilitating. I believe in the law of attraction, and if you really believe, then you can get it. So with that, I had tests done on my sperm, and at one point, before I came to Harley Street Fertility Clinic, it was only 20,000. That, what I was told, is pretty much infertile. Ladies and gents, I'm not the technical person. I try to talk a bit like a layman, but I think you need to have 20 million to be able to have normal semen function. So 20,000 is, wow. Okay, so that hits you. Hang on, what have I done? I've mucked up. I've done some stupid things. Hang on, I've not done stupid things for years. You know, I'm a healthy man. I take these supplements, and I know all about my health. I know how to get big muscles and keep strong. But I started to research everything that I was ingesting. Normally, as a healthy, responsible adult, I would go 80-20, 80% bad food, 20% a little bit naughty. But during the time when I found I had 20,000 semen, I went 100%, 110% pure, perfect. Whatever I put in my body, I researched thoroughly. I wanted to know what I was taking. I was taking this Chinese herb called ginkgo biloba, which is good for your mind and your memory, and it's great for keeping you sharp, but it's not great for your reproductive organs. So I stopped that. I took a lot of coffee. I had lots of saunas. They're healthy. They're good for you. Hot baths. I was training like a demon because that's good for you, keeping fit. But au contraire, there's excess. And the level I was training, I was pushing myself so hard. I'm destroying my reproductive organs. I'm not recovering. I'm getting run down. And I'm pumping myself full of all of these different supplements. All these go fast pills, not steroids. I mean, and this is the funny thing. I think I'm being healthy because I'm not doing the unhealthy things I used to do, but I'm pumping myself full of all the stuff in the health food shops. Not so great. You need to get your body, you need to be a bit kind to yourself. It's a mission. So for your reproductive organs to work properly, I stopped. Well, I haven't had any martial arts fights for many years. And I was careful to not push myself too hard, did a bit of training, and I relaxed. I did more yoga. And the main thing I did, and I wouldn't even call this hippie, but pray. The power of your mind and to be listened to, and to the intention, and to look at a positive outcome. And that positivity is so important. You're arguing with your missus, with your partner, because things aren't going well and you're feeling insecure about yourself, your manhood. And so it's good to keep calm. And the thing I found with lovely Dr. Venkat, I had a semen test and I was 20,000 just before I came to the Harley Street Fertility Clinic. And we had another one, and it had raised by a remarkable level of several hundred thousand. And Dr. Venkat said, whatever you're doing, keep doing it. And we spoke like it was a team effort. And that was great, because before, and I've been to other fertility, sorry, I'm going all over the place. I haven't got my slides. We've had, unfortunately, we have seven souls in spirit from our various adventures to try and get my beautiful little girl, baby Anastasia Pixie Reid, who was born on the 13th of July last year. So she has 7 siblings in spirit. And that's, I was always positive. It's all right, it'll be all right. We're going to keep going. And I had to do that. I had to keep going and believing we are going to get there. We discovered something really big with Nicola, my partner. She had killer T cells, which was part of the issue. But what else was going on with the semen, my semen, that I didn't know? I had lazy semen. They weren't really wanting to swim. Too much coffee, too many hot baths, too many saunas. Like I said, I cut out everything bad, and I researched every single supplement I should take and not take. Now, there's a caveat to this. You can pump yourself again, like I did. I wasn't taking steroids. I was taking all these proteins, and you think you're being strong, but it's not good for your bits. So I didn't get my blood work done, but I did have my semen tested, and it was increasing again and again and again. I'll tell you the different products I took. Dr. Venkat said, whatever you're doing, keep doing it. It's working. The products I took a general, I think it's called Bud. It was a general, it covers all the bases for male fertility, which was a great supplement. The one I really took, which was great, it's a Chinese Ayurvedic herb called Tong Kat Ali. Fantastic for testosterone, for male libido, sexual health, and testosterone. I have low testosterone. I think, again, probably from the drug misuse in the past, although that's, we're talking a decade ago, but still, I wonder how much effect that's had. But more importantly, I'm getting older, and there's an immense amount of stress, and the fact that I'm not being able to reproduce and have another child, that mounts up. So that's more stress. So belief, prayer, meditation, not pushing myself so hard, putting the right things in my body, things like Tonka Ali, maca. There's so many different herbs. I could go for a whole list of them. And being kind to myself. And it was great because from a period of 3 months, I increased my sperm from 20,000 to 77 million. Whatever I was doing, I was doing it right. And like I said, I go on the 80-20 rule, 80% healthy, 20% a little bit naughty. And I think that's a healthy way to live your life. But in those 3 months, I was 100% perfect in everything I ingested. It was a short mission. If you keep getting the same results, doing the same thing, you've got to change something. So I did. And it worked. We now have the most gorgeous, beautiful little girl. And I actually said this yesterday. I've never been so happy in my entire life. I'm tired. I'm so tired because little one's teething at the moment. But this is a short period of time. I'm an older man. I'm not that old. I'm 46. I mean, I feel young in my heart. My body's a bit bashed from all of the years of competing and doing my martial arts. And little Pixie is teething, so we're not sleeping great. But this is only going to be a short period of time, and I'm enjoying every minute. And I look at her, and even though I'm tired, that little smile, and that it just makes it all worth it. So there was stressful times. Obviously, me and Mum rowed a lot, but we love each other so dearly. And there's going to be a few rows. Well, maybe not for you, but it was for us. And there's still a few rows. And I think that could be healthy. We work, but what we have more than anything is love. And that's the thing that carried us through. Prayer, research, avoiding the certain things. Obviously, I wasn't smoking weed or doing drugs or no coffee. I was taking the right supplements, and have the most gorgeous, and I'm so grateful, beautiful little princess. And we are going again. So watch this space. So Harley Street Fertility Clinic, Dr. Venkat said she needs a sibling. I hope it's a little boy, but who knows?
We'll see next year.
There you go.
Thank you, Alex. So now we have a few questions. The first one, I believe, is for Sam. Sam, are you still on the line?
Yeah.
Great. How can a poor motility and morphology be corrected? Can the two terms be explained and chances of having a good IVF?
Oh, I don't think this is necessarily for me. It could be for Sheena. Morphology being corrected is quite difficult. Okay. Was the other one motility?
Yes.
It depends. There can be lots of things. It could be healthy living. It could be taking some supplements. It could be that maybe you've had an illness in the past 3 months, which has made your temperature and has reduced the motility. There could be lots of different reasons and lots of different ways that you can try and optimize semen parameters.
Thank you. Tina, would you like to say something? How can a poor motility and morphology be corrected? Can the two terms be explained and chances of having a good IVF? Would you like to add something?
Oh, sorry, you're asking me? Yes, well, I'm always inclined to say if men have poor semen quality, to go and see a urologist. Because really, if you can improve the quality of your sperm, even before you have treatment, then it's going to improve your chances of success. And it goes back to the slide where I was showing that men need more than just a semen analysis. And there are lots of fertility clinics. I'm not sure if Harley Street has one, but certainly that most fertility clinics can refer you to a urologist or have someone, in a male clinic who can talk to you about male health. Because it could be that the man has poor motility because he has a varicocele, and that can be repaired, as I was saying, and then his sperm can be much better quality within 6 months. So it's worth having a look at some of the causes of the difficulties that you have, so that you can do something to try and fix them.
Thank you. We have everything. We have urologists and andrologists.
Brilliant.
I just want to add to that. I mean, obviously, I took all the different supplements, which were great. But the main thing out of all of that was the stress, lowering your stress, and believing. It's hard. It's a hard thing to do, but it's just lowering the stress. It's a magical recipe. Of course, with all the other stuff going on as well. I mean, it's not the only thing. You've got to do all the other you cover all the other bases. But if you're already tight and stressed and relaxed, it's not going to work as well.
Yeah. Anything that's bad for your health is bad for your fertility, and stress is bad for your health, so they're bad for your fertility as well.
Amen.
Thank you. Are bacterial infections more dangerous than viral infections in men? And any lasting effects on fertility? Another question.
Well, bacterial infections can be sorted out with antibiotics very often. Viral infections, there's very little that you can do to fix those. So in a way, the viral infections are the worst ones because you can't fix them. But it's very hard to know what viral infections people have. I mean, the one that we would talk about at the moment is COVID. And did COVID have an effect on people's fertility? And it's hard to know the answer to that, because people who had COVID had high temperatures, they had fevers. Sometimes they were on medication for, to try and reduce their symptoms. So it's very hard to know if it actually was the virus which was causing the effect on semen parameters and fertility, or whether it was some of the other things, you know, like the fever and the malaise and all the other things that went with it. But there's not very much that you can do in those situations. And yes, there is no doubt that these can impact on male fertility as well, which is unfortunate, but it's hard to know what we can do to resolve them. Bacterial infections we can fix.
Thank you. Another question, should men freeze their sperm when they are 35 or before they turn 35? Or what is the optimum age to freeze sperm?
Is this for me as well? Well, I think the better thing to do is to stay healthy. I think it's a terrible public health message to say to men, freeze your sperm and then you can go and take cocaine and do crazy things. And you'll have your sperm frozen. I mean, let's remember that when you freeze sperm, only about 40% of them survive freezing. So I wouldn't necessarily say that freezing your sperm is, you know, a definite guarantee that you're going to have enough sperm. And of course, the other thing is, if you freeze your sperm, the only way that you're going to be able to have your family is through some sort of assisted conception. And most men, I would think, would prefer to have their children the old-fashioned way, if it's possible.
I agree with you, Sheena.
Okay. Thank you. I believe there are no more questions. No?
I've got a question there though, ladies, in terms of that. I'm 47 next month. And for gentlemen like myself, we already have some embryos in the freezer already. We've done the sterling hard work to get the best, most fabulous super sperm embryos. If I am my sort of age and I'm like, still haven't got a child, I'm like, maybe I might, hold on, I've done all this healthy stuff and I still haven't found the right person. And as much as I want to have a child as naturally as possible, maybe it might be an insurance policy to freeze my sperm.
Yeah, you're absolutely right. And that's what people are thinking. And certainly there are a couple of companies in America in particular called Legacy. One of them is, another one's called Daddy, D-A-D-I. And they are freezing men's sperm for that very reason. And also for American military who are going off to battle, they're saying, well, look, freeze your sperm first. So yes, it can be done. I'm just saying that I think for most people, they would prefer to stay healthy and to have but I do agree that having children when you're younger is probably a good idea. Although, of course, it doesn't, you know, people have second relationships. They have children when they're older, but the healthiest time for people, both men and women, to have their children is when they're younger.
Alex, we see lots of people that do freeze insurance policy.
Okay, well, I'm going to have to go, I'm afraid, because I'm getting a flight to America at 5 o'clock tomorrow morning.
Okay, thank you very much.
Well, it's been lovely to talk to you.
And you, very interesting. So thank you very much for the opportunity to chat. And good luck, everyone.
Thank you for taking part in our webinar, and thank you everyone for listening to us and joining our webinar. Thank you, Alex. Thank you, Professor Lewis. Thank you, Sam. See you at the next webinar, 7th of June, fertility options for same-sex couples. Have a good evening. Have a good evening, everyone.
Bye-bye, guys and girls.
Bye.
Take care. Bye-bye.
Bye.
Bye.